This is a story of resiliency of Linda Rose Blank, narrated by the Clinic for Special Children. Our daughter, Linda Rose, has been a patient at the Clinic for Special Children for 33 years. She was first seen at the clinic at 4 years old. It was quite a few years before the doctors had a name for her illness. She is diagnosed as having HARS syndrome. HARS is an autosomal recessive disorder, presents itself in early childhood with vivid and frightening hallucinations, and is provoked by illnesses. The episodes cause progressive loss of hearing. Children are usually deaf by school age. They progressively lose their vision and typically are legally blind by young adulthood. Linda Rose was 20 years old when she became totally blind overnight. Although we do not know of a cure, we now have a better understanding of her condition and what brought it on, thanks to the dedicated doctors and staff at CSC. Through her school years, Linda Rose was deaf and visually impaired. She was walking in the lane one afternoon after school when her father came behind her with horse and buggy. He didn't want to stop for her because her Christmas gift was in the buggy. Linda Rose sensed something was coming and stepped off the pavement. Not wanting to pass her, he stopped the horse. Linda Rose was confused when nothing passed. Cautiously, she stepped back on the pavement and continued walking. Again, her father started his horse with a slow walk. Instantly, she stepped off the pavement. This is how sensitive her sense of touch and feel is. Linda Rose is now 37 years old and completely deaf and blind. We communicate with her by signing in her hands. She is an avid Braille reader. Braille books are very expensive, but worth every penny they cost. Linda Rose would describe the clinic as a caring place. An example, 1 year ago she was struggling with what we thought were emotional problems. When we happened to think about her wisdom teeth, our fears were confirmed. After being sent to the third dentist, he would only do it in the hospital. We were told there's no opening in the OR for 2 months. A month had already passed, and we knew with 3 infected teeth in her mouth, this is too long. We called the clinic and explained our situation. They got busy. Later in the day, we received a message telling us to have her in the hospital by 10 a.m. the next morning for a 1 p.m. surgery. We are grateful to the clinic for this type of service. Let us support the clinic the way they support and care for these children with special needs. God bless you for your kindness, the Blank family.